Hey, what's going on, Zach?
Not much, man. Thanks for coming.
Yeah, very good. My name is Dan Pope. I'm a physical therapist and a CrossFit coach, and here with Dr. Zach Long, right?
Yeah, got the
Very good.
DPT, lifelong physical therapist, barbellphysio.com, and CrossFit coach, writer for CrossFit Journal.
Yeah, very good. So, what do you want to talk about today, Zach?
Let's talk about Sumo Deadlift High Pull and just in general. Is it a good exercise for people to be doing? Are we wrecking shoulders by doing it? What can we do to make it better, maybe?
Okay, good. So, I guess Sumo Deadlift High Pulls. I think the reason why it gets a lot of flack is because of like the top position of a Sumo Deadlift High Pull is right about here.
Yeah.
It's pretty similar to a test we have in the physical therapy realm called the Hawkins-Kennedy test. And it's a test for subacromial impingement syndrome. So you have a small space inside of the shoulder that oftentimes gets some of the tissues inside of there get a little bit irritated, namely part of the rotator cuff and the biceps tendon. And when I take my arm across my body and I go down and internally rotate, it can take the acromion, or excuse me, the greater tuberosity into some of those sensitive structures and cause some pain in people that do have some problems or pathology there. So constantly doing this exercise in healthy individuals, not exactly sure if that's good or bad. What are your thoughts, Zach?
Well, just like any exercise, there's going to be people that don't like an exercise where their body kind of kicks back at them a little bit for doing it. There's going to be plenty of people that do well with it. So, I don't like in general saying that any exercise is bad for everybody. So there's people that'll like it and people that don't. Is it one of those exercises that might be a little more risky than others? I think absolutely.
Okay.
So things that I'd want to look at if we're talking specifically to individual athletes on if they want to do it. What do you think?
I personally don't put them into my own programming. I can see how it might be a pretty good exercise for individuals when they're trying to learn the Olympic lifts and they're trying to get the shoulders high and outside, which I think can be good.
Yeah.
I generally don't coach Olympic lifts with the Sumo Deadlift High Pull too much myself. I just haven't found that it has the best carryover to Olympic lifts, but I think for some individuals, it can definitely be a good tool. I also think from a conditioning standpoint, if we're trying to do a lot of repetitions of a given exercise, I'd rather not pick something that stresses the tissues on the inside of the shoulder, just because I think they already take a lot of heat. So again, I agree with you. I don't think the Sumo Deadlift High Pull is inherently a bad exercise. I just think that in the population that I work with, it's probably not the best for them, I guess I could say.
Yeah, you got better exercises that you feel like are maybe a little less potentially risky.
Yeah. Cool. Did you want to talk about some of the mobility requirements for this exercise?
Yeah. I think the biggest one people have to have, you have to have adequate internal rotation of the shoulder. If you don't have really good internal rotation, then you're really going to close down into that subacromial space that you were talking about as you get high up. And especially the way CrossFitters talk about it, where they want you to literally get the bar up to your collarbone. That's absolute max shoulder internal rotation, which is one of those things that a lot of people are already missing. So if you don't have that, you're kind of asking for a little bit of trouble there. So that's my number one. What else do you like to look at?
Yeah, I think that's really important too. For those that don't understand, I don't have a sweatshirt on here, which is a little tough to see, but if I come up into this position and I try to internally rotate, if I don't have full internal rotation range of motion, I'm not going to be able to keep the bar close to my body. And the other part is that I can have my shoulder sink forward this way, which Zach is saying that's going to decrease the subacromial space a little bit, potentially bother some of the tissues that are inside of here. So if I don't have internal rotation, it's not going to be a good exercise to show my athletes how to Olympic lift properly, because they're already not getting the bar close to their body because of that. I agree with you there 100%. Do you have any exercise you really like to help to promote internal rotation?
It's one of those things where there are a lot of different things out there that'll work. I had really horrible internal rotation in my shoulders, and actually for a long time I would not Sumo Deadlift High Pull because of it. And I tried everything from PRA exercises to doing some rolling on the back of my shoulder to having other PTs posteriorly mode me. For me, the only thing that worked was using, you've probably seen the rotator product. That was the only thing that got my shoulder internal rotation better. But for a lot of athletes, I'll do like a repeated shoulder extension that our friend Urson from the manualtherapist.com always talks about, where he'll just repeatedly take people as far into extension as they can, and that'll a lot of times produce some quick results. Or I'm going with, lacrosse ball, gently working on the back of the shoulder, and some like horizontal adduction stretching, things like that, to get the posterior capsule, posterior musculature a little bit more flexible.
Yeah, I like those. I think those are good.
Yeah.
I generally do the same in the clinic. I guess it really depends, right? You can be limited in the shoulder in a variety of places. Posterior shoulder, posterior capsule, sometimes implicated. A little controversial whether or not you can actually change the capsule per se. But for throwing athletes, at least when they're doing a ton of throwing, the posterior shoulder does get tight. Most of the research about missing internal rotations coming from throwing athletes. So you see a lot of posterior shoulder work being very effective. For CrossFit athletes, they're constantly dropping barbells from overhead and trying to control that. So high rep touch and go snatches comes to mind. And one of the things I find is that dropping bars from overhead and trying to control that motion is kind of similar to throwing in that regard. So I do find a lot of athletes do have some tightness on the backside of the shoulder. So I work that quite a bit, and it does tend to be pretty effective. Going back to the whole idea of everyone being different, a lot of times in the hip, we talk about this all the time. So everyone's got a different shaped ball and socket joint. The same thing happens in the shoulder. Some individuals have different version of the socket, so it faces in different ways, especially throwers get different bony changes as well through the course of throwing, but it's going to change the ball in the socket and the amount of rotation that you do have. So sometimes these individuals also have bony reasons why they can't internally rotate really well. So when you're talking about individuals that might not do well with the Sumo Deadlift High Pull, I would definitely take this into consideration as well. Just might not be a good exercise in general. So have you found that?
Oh yeah, you'll definitely run into a lot of people who you're going to hit a roadblock, and they're never going to get complete shoulder internal rotation, no matter what manual therapy you do. I actually thought that I was probably dealing with more of a bony issue myself because of just how much stuff I tried to improve my internal rotation, and nothing worked. So I really thought I was kind of in that category you were just discussing before I happened to get a rotator. And for whatever reason, that versus just, I could sit and do a sleeper stretch or whatever other stretch you wanted to do, it didn't change, but the rotator changed my game. That is not an affiliate plug-in, anything like that. But I, for whatever reason, that was an awesome thing for me.
Yeah, good stuff. So I'll ask you a question. What do you think, when do you think a Sumo Deadlift High Pull is a good exercise for somebody?
When do I?
Mm-hmm.
The only time, so I'm not I don't program. Programming's not my strength. I can analyze your movement. I can help make you a better athlete through some things, but programming, I think I've told this to you before, I think there's only a small number of people that could really understand how to truly program. That's not me. So I'm not a programmer. If I was, the only people that I would ever program Sumo Deadlift High Pulls for are probably CrossFitters that are going to see that in a competition. Like you said earlier, like there's better exercises to do for your conditioning, things like that. I would rather do 20 other exercises before that. But if that's going to come up in your competition, then you better work it every now and then.
Yeah, I agree with you. It's one of those things where if that exercise is going to show up, you probably have to have some familiarity with the exercise. I think it's good to have Sumo Deadlift High Pull, maybe potentially for people that are having trouble with the elbows high and outside position. I just think it's a little funky with the stance. Why do you change the stance up so much in order to do that? I definitely think it's a good conditioning tool. They make you super tired.
Yeah.
I've used it a little bit with kettlebells. I don't know why, but something about the kettlebell seems to feel a little bit better in my shoulder.
I agree there.
Yeah.
Barbell gets really awkward.
Yeah. But yeah, if you've got athletes that are going to be doing a whole ton of those, for one, they have to know how to do the lift efficiently, right?
Right.
And two, I think there's also some credence to saying that if you don't prepare a joint for the demands that it's going to be taking, then it's going to be a little more risk for injury. So, I feel like in some ways that maybe you're fighting fire with fire. This may be an exercise that potentially could bother some people's shoulders, especially if they have some previous issues with pathology in their shoulders. But we also want to make sure that they're ready for it. Is there anyone you would say, hey, definitely don't do this exercise or proceed with caution?
Probably just anybody that has chronic shoulder impingement problems on and off, dealing with it nonstop. I'm going to probably try to get them to stay away from it. Anybody with horrible shoulder internal rotation, just giantly rounded posture, things like that.
Mm-hmm. Okay. So we talked a little about internal rotation being important for range of motion for a sumo deadlift high pull. Is there anything else you need to do a sumo deadlift high pull safely for people out there that really need to do sumo deadlift high pulls?
So from a lower body perspective, the position you're in a sumo deadlift, I don't know that I can really think of a whole lot of people that have such bad mobility that they can't get into a sumo deadlift position. But you definitely, I'm sure there's some people out there that are going to have problems with that. You definitely need to have some thoracic extension. And I think probably more than anything else, secondary to the shoulder internal rotation is going to be having some scapular control, making sure your scapula are properly upwardly rotating, staying nice and stable against your rib cage as you go through that motion.
Yeah, I agree with you. Cool. Anything else you want to discuss about this lift?
No.
What's the different exercises for sumo deadlift high pull?
I think my first change is probably, if it's a CrossFitter and like that's your prescribed workout, and you want to do something as close as possible to it, then I'm just going to limit your range of motion a little bit. Otherwise, I don't see why not just do clean pulls, snatch pulls, things like that, where you're just probably not quite as in that inside, maxillary internally rotated position. You're going to get the same hip effect. You're still going to get the shoulder shrug, pulling up. So those are probably the closest things to resemble that you could do.
Yeah, I agree with you. I think, I guess it depends on what you're trying to improve. I think from a conditioning perspective, you can probably get a lot of similar work with a more basic exercise, maybe like a swing. Mm-hmm. Could also do maybe any type of clean variation, snatch variation, as long as that's okay on the athlete's shoulders. I think those are going to be something that's really similar as well. From a technical standpoint, and at Verve, we use a little bit of sumo deadlift high pull variations for some of our athletes when we're trying to teach them Olympic lifts. So I think that can be helpful for a lot of people trying to learn how to do triple extension and then try to utilize the upper body as well and put that all together. I personally think that, just like you said, you can teach a lot of that with clean pull, snatch pull variations, high pull variations, which in reality is just like a sumo deadlift high pull, I guess, and then progressing towards kind of muscle snatch, muscle clean, and then the actual power clean, and then putting the squat in there, I guess. So you have a lot of options, and I think for some people it can work out pretty well, and for others maybe not. And you have a variety of exercises if you're not able to use a sumo deadlift high pull for that athlete. So, do you agree with that?
Yeah, 100%.
Okay, cool. Yeah. Anything else?
That's what I got for sumo deadlift high pull.
All right, good talk, man. Glad we finally got together to do a little discussion here. Hopefully we can do some more of these in the future.
Yeah, sounds good, man.
Yeah, very good. All right, well, thanks guys for watching. And I'm Dan for Fitness Pain Free. Zach, anything else?
Nope, we're good. Zach, barbellphysio.com.
Okay, thank you guys.